remember, the National Commission of Women team was in Calcutta at the spot, and their inquiry committee has now uncovered the lapses. Let me show you what is the lapse. One, inadequate security in the hospital. No security guards present when the crime happened. So there was absolutely no security at that point. Lapse number two is the poor facilities. Lack of basic amenities for female doctors as well as nurses. This is what the NCW team has found out. They said the washrooms are in poor conditions, inadequate lighting as well. So these are the lapses that the NCW inquiry committee has covered when they visited the hospitals and took stock of the situation. The third lapse is incomplete investigation into this questioning of former Dr. Sandeep Ghosh remains completely incomplete. Remember, he was not summoned by the Calcutta police, and he had resigned. He did not resign from his post as well. Lack of protection, poor safety for on-call female duty interns and doctors. There's no safety for them as well. Evidence tampering. Now, this is a big allegation and claim by the NCW inquiry committee that sudden renovation where the crime took place. They are saying that the sudden renovation has started at the place where this crime in fact took place. As far as the demands are concerned, these are the demands that have been put out by the Indian Medical Association. Remember, they have announced a nationwide withdrawal of medical services. So this is the demand one. Reluctance to acknowledge violence on doctors has to change. Demand number one is this. Demand number two is security protocols of hospital should be like of that of the airport. See, this was a major demand of the IMA that hospitals, in fact, should be announced as the safe zones, just like the airports. Demand number three, declare hospitals as safe zones is what I mentioned, with mandatory security entitlements. So same security infra just as you see at the airports. Demand four, thorough overhaul of the working and living conditions of the residents doctor, because see, the NCW inquiry committee also flagged this. Demand five, meticulous and professional investigation of crime in a time frame. Demand six, identify hooligans of the vandalism and award them exemplary punishment is the demand number six of IMA. Demand seven is appropriate and dignified compensation to the bereaved family. They're seeking for the compensation. Financial help to the victim's family is the demand number 7 of the Indian Medical Association. My colleague Tapas joins us live on the broadcast. Tapas, we've been seeing protest after protest, not just in West Bengal, but also all across the nation. And today, IMA has said that they are withdrawing all the medical services except for the emergency care. Give us more details.
Well, yes, day before yesterday, the IMA had, the National IMA had made it very clear that they will be going for a cease work in all kind of medical facilities, be it the government or the private facilities, but barring medical emergency services, they will continue to cease work in OPD and other non-emergency services. However, in Kolkata, in most of the medical in private hospitals, we have seen that there is not a blanket ban as far as the cease work is concerned. It is left up to the doctors, be it the junior or the senior doctors who are attending the respective department. If they want, they can go for a cease work. But yes, definitely a 24-hour cease work on emergency and non-emergency services and OPD facilities is definitely going to take a toll on this. But yes, there are several other demands which have been put forward by the National IMA needs to be met with immediate effect is what they demand from the government. And today there are multiple rallies again planned by the doctors wanting their demand. Now we are seeing slowly and steadily it's not only the IMA or the doctor fraternity. Now people from all strata of the society is also coming and joining the protest, be it the celebrities, be it intellectuals. Now slowly and steadily they are all coming and showing the solidarity towards the family and also standing by the demands of the protesting doctors.